glucose monitoring devices the last 10 years. Also, scales that can connect to Wi-Fi and monitor weights on a daily basis. For patients who are obese, also for patients who have congestive heart failure. Where they accumulate fluids and they need to check their weights on a daily basis. Same for blood pressure. I have patients that visit me in the clinic. I tell them, you don't need really to come and see me. You need to come and see me only once a year, honestly, for just to see you physically and examine you. But the rest of the year, you really can just do your labs, send me your numbers, and I can manage you remotely. So I think having wearable devices for this type of patients, hypertensive patients, is very helpful in compliance, reducing cost.
Analysis of that data so that we minimize false positives and false negatives from an alert perspective.
Right.
And segment the population on the basis of health, basis of risk of those conditions, and then target our medical care to those people. Now that, from the work I've done, and I've been looking at this since 2007 when I was part of a very large telemedicine project in England, we had called the Whole System Demonstrator. The benefits are really significant. The problem at that time was the technology didn't facilitate us being able to minimize the number of false positives and false negatives. But wearable devices that allow AI to look at the data and then from a pattern give a clinician an alert, we can then segment the population on the basis of risk, target our resources to the most effective. And from work I've done with the King's Fund some years ago now, a model of care like that can reduce the cost by around 30%. But more importantly, from my perspective, because we seem to be able to print money,
that's another session.
Okay. I wasn't going to stray there, but I think the most important area for me is that we minimise those life-changing
events for the patients.
But also we take the strain off the clinical people, because globally there's a shortage of doctors and nurses and other professionals, so that we target the care, so that we get into the preventative mode. I mean, developing those lifestyle choices very early on. I mean, imagine a wearable device that children wore that maybe had a cartoon character. So rather than mum and dad say, don't eat those sweets or drink so much Coke, their little friend on the watch developed so we could get lifestyle. So I think there's a whole massive development opportunity around the use of wearable devices, but we need an ecosystem that also supports lifestyle coaching, medications management, and also is informed by clinical best practice, be that BMJ, Elsevier, or today, so that we have consistency, and it's passive from the patient point of view, that the patient really concentrates on that. So I think there are huge opportunities. We're not there yet, but we're very close, and I would hope to see that. So I think from a healthcare provider point of view, the opportunities are considerable.
Right. And
I think from an insurer's point of view, cost reduction, because some insurers, I know in my own country, if you have a condition, then they put the premium up to such a level that it becomes unaffordable for most.
Right.
What we want to be able to do is to retain those people who actually make the effort. So we've seen one of the insurers over here, Vitality, for example, give an Apple Watch to the people. And I think that's a trend that will continue. So we need a climate ecosystem, and I think, with massive savings, but I think most importantly, it will limit the number of amputations, strokes, and cardiovascular disease that we see. That's just in diabetes, but there are many other benefits. Sorry, I haven't strayed too far.
I think you've given such a holistic answer. It's fascinating. I was writing a couple of notes down because I was like, oh, that's important. No, but one thing that you mentioned, that you said you did research a couple of years ago, and the technology couldn't kind of keep up. I mean, I'm a data person, so I see tons of opportunity in data first principles in this particular field, with semantics helping to bridge the gap, contextualizing the data so that you can make the targets and the risks. But I just wanted to say that it's fascinating what you're speaking about. And I think that that shift is definitely something that I think all countries will struggle with, but need to put rubber to the road and get on the bandwagon and move.
The reason I look the way I do when you mention semantics is I'm just in the process of trying.
This is Althea Davis, once again, managing partner and the CDO for Eventology, editorial board member for the CDO magazine, as well as the country ambassador for UAE and a board member for the International Society of Chief Data Officers. And she will be moderating a panel called Data Panel. It's a 30-minute panel discussion session, which is about wearable technologies. Where are they useful for both practitioners and insurers? Now, owing to an emergency, one of our panelist speakers, Frederick Bishop-Jurg from Daman National Health Insurance Company, the executive director for digital transformation and innovation, apparently he met with an accident, so our prayers are with him for a speedy recovery. So we would, so unfortunately, he will not be joining us for the session. But we have Professor Miller, Michael Miller, the WHO Digital Health Technical Advisory Group roster of experts from the World Health Organization. And from Saudi Arabia, I have Mr. Nasser Al-Jahani, the Associate Medical Director for the Council of Cooperative Health Insurance, joining us for this interactive panel discussion session. So I would like to request Mrs. Althea Davis to take forward the conversation. And if I may request Nasser Al-Jahani, if you could, sir, tilt your phone, your device to horizontal, we will be having a spectacular view of you. Thank you very much.
Perfect.
Thank you. Oh, this is perfect. So
perfect. We got a smile.
Take it on.
Salam alaikum.
Alaikum salam wa rahmatullahi wa barakatuh.
Yes. Hello. Hello. Welcome, everybody. Greetings from Abu Dhabi. In the UAE. Hello, everybody. Hello, Nasser Al-Jahani, and hello, Dr. Michael Miller. Welcome to the panel.
Thank you. Shukran.
Shukran. Okay, you're welcome. So, gentlemen, we're going to get started. I have a couple of questions for you, but of course, let's make it a wonderful conversation for the audience. So I will start off with Nasser, good afternoon. I think it's good afternoon for all of us. I want to start with maybe not, Michael.
No, 10 o'clock in the morning in England, but there you go.
You're in the UK. Oh, I'm so sorry. 4 hours difference. I'm speaking to the UK every day. I just didn't realize it. Sorry about that, Michael.
No problem.
Okay. So Nasser, how effective are wearable devices, in your opinion, as a health management tool? In this particular age, we're in the information age, the fourth revolution. So what is your opinion on that?
Yeah, I think, so do you hear me well?
I hear you perfectly, crystal clear.
Okay, excellent. Excellent. So I think that will depend on the disease and the patients that we're trying to manage. As you know, when it comes to chronic diseases, we have the lifestyle diseases, diabetes, hypertension, obesity, where there is a really high burden of these diseases, high impact, and also high number of patients.
Yes.
And wearable devices, I think, for these type of patients and diseases play a major role in helping these patients get better control and connect the patients with their physicians or the people who are going to help them.
Yes.
So I know, there has been a huge advancement in glucose monitoring devices the last 10 years. Also, scales that can connect to Wi-Fi and monitor weight on a daily basis. For patients who are obese, also for patients who have congestive heart failure, where they accumulate fluids and they need to check their weights on a daily basis. Same for blood pressure. I have patients that visit me in the clinic. I tell them, you don't need really to come and see me. only you need to come and see me only once a year, honestly, for just to see you physically and examine you. But the rest of the year, you really can just do your labs, send me your numbers, and I can manage you remotely. So I think having wearable devices for this type of patients, hypertensive patients, is very helpful in compliance, reducing cost, absolutely, and it's very convenient for the patients.
Right, right. No, that's really, and are there any areas where you say, you know, we don't have wearable devices yet in that area, and if we could think of something that would be amazing for, let's say, this region, like you said, the lifestyle diseases? Are there any ones where you say, we need to do more work in that area, in your opinion?
Sorry, question to me?
Yes, sorry.
No, okay, sorry. Can you repeat the question again?
Yeah, not a problem. So you gave some great examples of where we can use these wearable devices, and they really make a difference and staying the benefits. But are there, let's say, specific diseases or specific, let's say, segments of an existing chronic disease like diabetes, where you say, you know, we haven't made advancements yet in that area to create a wearable device, and maybe it would be really good and beneficial? Is there an area that you think it would be really beneficial, but we're not there yet?
Yeah, I think, what I would think is patients who need to be on telemetry. I haven't seen real advancement in that area. Telemetry is a device that you ask the patient to put on for a couple of days or a week, and then they come back, and then you need to download the readings and then read them. So, but there is a number of patients where you need them to take their telemetry to go home on, and you need to remotely monitor them. So that's kind of a device that I haven't seen advancement on. Other ones, I would say not necessarily wearable devices, but I think that the whole idea is to connect patients
to the doctors,
caregivers. Yes. So there is still information that we need from patients, like the patient-reported outcomes, patients on pain medications for pain management, where they can really actively log or fill in surveys or other information.
So collection of information about their condition and what they're doing.
Yes, exactly.
Okay, thank you very much. Thank you very much for that answer. Dr. Michael Miller, I'm going to go over to you now. Hello. Good morning again. Good morning.
Good morning.
Good morning. Where are you in the UK today?
Not far from, if you're familiar with a book called Winnie the Pooh, from where the author used to live. So I live in a place called East Grinstead, not far from Town Forest, where the famous place is. So about 8 miles from Gatwick Airport.
Oh, that's cool. That's cool. Well, I wish I could send some sun over to you from the UAE, but
Please.
And NASA can send some from Saudi Arabia as well. It'd be a joint.
Yeah, I've been there as well in Riyadh. I worked at the ministry for a year. It's excellent.
Great, great. So, Dr. Miller, in your opinion, are wearable devices able to empower healthcare providers? And I ask you this question in the spirit of what I've heard the last couple of days in this conference, bringing in the human elements to healthcare. And in this specific question, it's looking at humanizing, the support for the healthcare worker. So what do you think about that?
I think we're in a process of change, I guess we always are. But we're moving away from a sort of treatment-based system to a preventative and treatment-based system. And also we're moving from a fortress-like structure of hospitals, acute care, primary health care, social care, mental health care, into a patient-centric integrated care system. I think that's the target of most nations in how they're delivering their healthcare. So wearable devices have a very key role to play in that. So let's perhaps, because I know time's limited, just consider one area, and that's the area mentioned by NASA previously, the area of chronic conditions.
Yes.
So pre-pandemic, the WHO was suggesting that 80% of the burden of healthcare costs globally is due to chronic conditions. So in a sense, it's the elephant in the room, and because of demographic changes in our population and lifestyle changes, they are really growing exponentially. So if we just look, for example, at one area, that of diabetes, you know, in the Middle East, the IDF, the International Diabetes Federation, says that by 2045, the number of patients will grow by 96%. In Africa, 43%. And globally, something like 51% by 2045. So we need to be able to help those chronic disease patients, and particularly in the area of minimising the development of acute complications, stroke, amputations, for example. So we're having wearable devices, and I think one of the big areas we're still waiting for in that is the development of a truly non-invasive blood glucose monitor. We hope to see Apple Watch 7, but it's not there yet. And but there are some work in Germany I'm aware of, and other areas where it looks like we're now pretty close. So I think we'll see that fairly soon. So then it's a question for the clinical staff of being able to monitor a patient, and it has to be fairly passive from a patient point of view. And we have to also consider the domain of comorbidities, where patients often have more than one chronic condition. One of the failings I think we have currently is that we tend to give patients different apps for different conditions. I think that's unlikely to have the effect we want, and therefore we need to have a holistic system that streams the data from a wearable device and then facilitates analysis of that data so that we minimize false positives and false negatives from an alert perspective. And segment the population on the basis of basis of risk of those conditions, and then target our medical care to those people. Now that, from the work I've done, and I've been looking at this since 2007 when I was part of a very large telemedicine project in England, we had called the Whole System Demonstrator. The benefits are really significant. The problem at that time was the technology didn't facilitate us being able to minimize the number of false positives and false negatives. But wearable devices that allow AI to look at the data and then from a pattern give a clinician an alert, we can then segment the population on the basis of risk, target our resources to the most effective. And from work I've done with the King's Fund some years ago now, a model of care like that can probably reduce the cost by around 30%. But more importantly, from my perspective, because we seem to be able to print money, it's,
that's another session.
Okay. I wasn't going to stray there, but I think the most important area for me is that we minimise those life-changing
events for the patients.
But also we take the strain off the clinical people, because globally there's a shortage of doctors and nurses and other professionals, so that we target the care, so that we get into the preventative mode. I mean, developing those lifestyle choices very early on. I mean, imagine a wearable device that children wore that maybe had a cartoon character. So rather than mum and dad say don't eat those sweets or drink so much Coke, their little friend on the watch developed so we could get lifestyle. So I think there's a whole massive development opportunity around the use of wearable devices, but we need an ecosystem that also supports lifestyle coaching, medications management, and also is informed by clinical best practice, be that BMJ, Elsevier, or today, so that we have consistency, and it's passive from the patient point of view, that the patient really concentrates on that. So I think there are huge opportunities. We're not there yet, but we're very close, and I would hope to see that. So I think from a a healthcare provider point of view, the opportunities are considerable.
Right.
And I think from an insurer's point of view, cost reduction, because some insurers, I know in my own country, if you have a condition, then they put the premium up to such a level that it becomes unaffordable for most.
Right.
What we want to be able to do is to retain those people who actually make the effort. So we've seen one of the insurers over here, Vitality, for example, give an Apple Watch to their people. And I think that's a trend that will continue. So we need a climate ecosystem, and I think, with massive savings, but I think most importantly, it will limit the number of amputations, strokes, and cardiovascular disease that we see. That's just in diabetes, but there are many other benefits. Sorry, I haven't strayed too far.
No, I think you've given such a holistic answer. It's fascinating. I was writing a couple of notes down because I was like, oh, that's important. No, but one thing that you mentioned, that you said you did research a couple of years ago, and the technology couldn't kind of keep up. I mean, I'm a data person, so I see tons of opportunity in data first principles in this particular field, with semantics helping to bridge the gap, contextualizing the data so that you can make the targets and the rest. But I just wanted to say that it's fascinating what you're speaking about, and I think that shift is definitely something that I think all countries will struggle with, but need to put rubber to the road and get on the bandwagon and move.
The reason I look the way I do when you mention semantics is I'm just in the process of trying to develop with the WHO Europe sort of standards for e-health, and because what we find with our e-health, and I'm conscious of this in Saudi and various other places all over the world, but my own country is a disaster, is that semantic interoperability has never really been addressed. And so what we're trying to do is so that we have the sort of single unified patient record that follows you wherever you go. And so I'm sort of engaged on that at the moment. But I hope maybe if they build NEOM, or when they build NEOM, that they may be able to do that in Saudi, for example, and those semantic interoperability challenges that, in my view, FHIR and HL7 never. I'm waffling. I'm sorry. I apologize.
But it's a huge topic. I second it. So we're going to give Nasser a chance to get back into this conversation.
Sorry. I'll turn my mic off. Excuse me.
It's very interesting. Yeah.
It is. Harmonized patient data has to start somewhere, and it's going to be in the basis of the common terms and standards and the semantic layer being established. And at my consultancy, we're all about that. So we are very much in that discussion. Nasser, we were just talking about, wearables. I'm going to come back to you with that same type of question. Sorry. So how accurate are wearable devices in providing data diagnostics for disease, in your opinion? And where do you find that they're most helpful?
Excellent question. So that's, I think, is a trust problem. I'm a physician, as I said, and there's always a question around the readings from those wearable devices. We are always comfortable with monitoring the patient with devices we own. We have. I don't want to make a decision based on a device. I'm not sure who the manufacturer is, how the patient took the measurement, how it's very challenging. But there is always a benefit from these wearable devices. I remember a case I saw a patient who had their Fitbit in their hand, and she came to the ER because she noticed her heart rate was high. And we saved her life. That saved her life because she didn't know about it. She came in, we checked her. She had an atrial fibrillation, which is when your heart rate moves very fast, beats very fast, quickly. And we admitted her that night to the ICU to save her life.
Wow.
So, I mean, haven't. If she didn't have that device, she would have not known about this.
Yeah.
So that was
She
very
wouldn't have
useful.
known.
So yeah, so I think monitoring heart rate is very useful. Certainly monitoring blood pressure, weight.
Yes.
Things that are very simple, straightforward. Unlikely to have errors.
Yeah. So if I can move on to the last question, and gentlemen, I'm going to pose it to both of you. So you just jump in, whoever wants to go first. The last question has to do with wearables and Internet of Things. What do you think the health insurers should take into consideration when it comes to wearables and Internet of Things being introduced heavily into the healthcare, let's say the new models? What are the kinds of things that you think the health insurers should consider? I mean, you just mentioned about, sorry, I think it was Michael who just mentioned something about reducing policies and that type of thing.
Yeah.
Sorry, go ahead, Nasta.
Yes, I can go. So it's investments, honestly. We have had challenge. So I'm currently the acting executive director of enablement and supervision. And it's one of my roles is to enable people to get covered. So we have had a struggle to get coverage for insulin pumps and glucose monitoring devices. Because insurance companies must see the return on investment in a short time. So the contracts are for 1 year. Yeah, the contracts are for 1 year. So they have to see the return on investment in a year. That's the life of the contract.
Right.
So in Saudi Arabia, the government established an entity called Health Technology Assessment, HTA. So the role of this entity, governmental entity, is an independent organization that reviews technologies and their cost effectiveness for the market. So we give them that task, and they came back to us with recommendations on really what if it should be covered, not covered. If it's covered, what's the deductible, what's the copay, how we're going to do that.
The whole economic models.
So it needs, and that's why I think we don't see much investment in wearable devices, is because who's going to pay for it? Patients are going to be reluctant. It's expensive. It's the beginning. It's always expensive. Insurance companies don't see the return on investment. We need to publish more about this so people are convinced they should pay for it. So that's the challenge we are in now.
Yeah, so I was just listening to what you were saying, because this is going back to the principle that you have multiple stakeholders in the healthcare wheel. So maybe in this example, the device is an investment. Somebody has to pay for it. But if you didn't have the device, the knock-on effect would be, a particular stakeholder seeing their cost of care going up. So maybe sometimes you have to look at the device, or let's say the actual thing, the solution, and kind of be able to deduct and share the cost, but also the benefits. So instead of looking across the value chain of the different stakeholders, being as their own pocket, which I know I'm getting into muddy waters, but overall, the cost, and I see Michael shaking his head and saying, that's utopian, but hear me out.
No. Can I just join in? It's quite opposite, actually.
Go ahead.
I don't know if you're familiar with the Commonwealth Fund Research Organization in California and their work, Mirror, Mirror on the Wall, 2000. Oh, well, it's worth looking at. Mirror, Mirror on the Wall, 2014, 2021. And one looks at, it's their research, it's American research. They compare 11 leading industrial nations' healthcare systems. And the USA consistently comes out the worst in terms of clinical outcomes, and is more than twice as expensive per capita as any other of the 11 leading industrial nations.
Right.
Australia, Canada, Germany, Sweden, UK. Whatever. So I'm a bit concerned about this market-driven thing, because it's not reducing costs. And then you see the United States of America are approaching the cost of healthcare approaching 20% of GDP, which is probably unsustainable.
Yeah.
And it excludes 40 million of its citizens from healthcare cover. I question whether that's the model that, countries like Saudi, well, anywhere in the world, to be honest, should be maybe going down that path. I think there's probably a better path, and I think they can avoid some of those issues.
Right.
But on the question of the Internet of Things, I mean, I think one of the problems with mobile devices or wearables is I found is that Bluetooth is sometimes not consistent, so you lose the readings. So I was fortunate enough a couple of years ago, pre-COVID, to be able to go to China. I was invited to speak over there, a healthcare conference, and I was fortunate enough to see. And they with their 5G networks, they're really improving, and with the ability of wearables just about to begin to sort of use 5G technology, I think we can get much higher reliability. And also the AI that goes with it. Trouble is with AI, I think it's often a sort of, it's a very sort of headline-grabbing term to use, but the reality is somewhat different. So I think insurers need to be able to understand and validate the AI that goes along with the devices. But also, I think the benefits for the insurer and for the patient are really, really significant. Unfortunately, there aren't many examples yet, and I feel for my friend Nasser in Riyadh there, that I guess that's where you are, and in trying to look for suppliers, it's not an easy issue at this stage. But I think they are coming, and will show a real major benefit. So the communication, I don't know where Saudi is with 5G. I think it's going that way. Unlike the UK, I see the sort of Asia Pacific region ahead of Britain, the West, which we're struggling to accept, but is a reality.
Right.
So I think that's the area I would look at: the AI, the clinical best practice, the wearable devices, because getting that data and using it effectively and making it as passive as you can for the patient. Right. So that all they've got to do is wear the device. If you ask them to do much more, particularly with chronic disease, where they've got it for the rest of their life, I think it's a real issue. And I guess I better shut up because you're all right.
Well, I must admit, thank you, gentlemen. I must admit my view on healthcare is a little bit biased. I had the pleasure of growing up in Toronto, Canada. So I totally understand what you're saying, Michael. I had the pleasure. And I also had the pleasure of spending over 30 years in the Netherlands, where I just came from just 2 years ago. And I've had the pleasure of living in the UAE. So I consider myself a fortunate person. To the point, patient care, reducing the burden on the healthcare system, including the healthcare workers, and of course, having an inclusive view on moving from a pure treatment to a treatment preventative, that's a healthcare ecosystem, are all really good things. And of course, I'm a data person, so I'd like to end it by saying all of what we've just talked about is about getting reliable data, good information, and great knowledge exchange so that we can move together and do amazing things. So thank you very much, gentlemen.
And could bring healthcare to millions or billions of people around the world who've never had it before.
Exactly. That's what it's all about, right?
And Nasser, would you give my best wishes to Dr. Ahmed Bolker if you come across him? All right?
Yes, absolutely, I will.
He's a wonderful person. I had the great pleasure of working with him. Thank you all for today. Thank you very much.
Thank you.
Okay.
Thank you, Nasser.
Thank you.
Dr. Miller. Thank you, everybody. Back to you, Fait.
Thank you. Thank you, Althea. Thank you, Nasser. Thank you, Professor Miller. Professor Miller, it's a coincidence to know that you're an Australian. So many congratulations to you. You thrashed us last week and you won the World Cup.